So why UK Healthcare? That was kind of an easy decision. Growing up about 2 hours from here in a small town, you always heard about UK Healthcare. If anything ever happened that was traumatic, they're flying you or driving you to UK Healthcare. So just the fact that wow, what's there? What do they have that we don't? My name is Kevin Duncan. I'm the radiology lead sonographer at Good Samaritan Hospital, and I've worked here almost 15 years now. So what led me to become a radiology sonographer? It's kind of a long story, but the first initial thing that piqued my interest was actually X-ray. So I decided to go into X-ray, so radiology. Well, in X-ray, you have to do a rotation in the different areas. The next rotation, you go through CT and MR, and I love that. I was like, that's what I want to do. The other part was the artistic part. It's like painting a picture. Everybody's different. And so you can make it too bright, too dark, everything in between. So that, along with the medical terminology, the medical imaging, all of that just kind of last minute decision. I'm not going to do CT/MR. I'm going to jump into ultrasound. And that's what I did. Some of the challenges that we're faced with is really every day we take a patient in, the actual stress of getting the perfect image. And so a lot of new sonographers, that's very stressful because unlike X-ray or CT where there's a lot of skill to that, but as long as you are doing what you're supposed to do, the images will be sent to the radiologist and they interpret and find it. So with sonography, we don't interpret, but we do have to take the picture. So the advice I would give a new student looking into the field of sonography is ask yourself why. Why are you doing this? Why healthcare? Why sonography? I've been doing this for 15 years and I've taught a lot of students. This is a job where you serve others. You give a lot. There's very little that you receive, and so that can be taxing and just a lot of weight and just draining. And so it's those little times when you want to get in healthcare, you want to serve and help people. That's the rewarding part, is when you're making a difference. You find something that they don't want to hear, but if you don't find it, then they'll never know. So that little part of helping them along with their care is rewarding. And so if that's something you want to do, then that is definitely something you should pursue.